Hello everyone. Today we will discuss about the features of humerus. As we know, this is the longest bone of upper limb. It has upper end, the middle part shaft, and this is the lower end. How to identify the side? The upper end, here this is a head, and when we focus in the lower end, this is expanded, this is from side to side. The head, it is directed upward, backward and medially. This structure, this is lesser tubercle, which faces anteriorly. Another part on the lower end, the largest fossa, this is olecranon fossa, which is present posteriorly. So, this humerus, this is your left-sided humerus. Now, one by one we describe upper end. This is upper end, this is rounded portion, which is head. This line, if I just turn the bone, again going like this, again coming here. So this roundness, this line, which is going to separate the head from the rest. This is head from the rest of upper end, this line. It is called as anatomical neck. It has two tubercles. This is lesser tubercle, this is greater tubercle. On the greater tubercle, you can see the three impressions when you go before backward, upper, middle and lower. This area between the two tubercle, it is called as intertubercular sulcus or bicipital groove. It has two lips. This is medial lip towards the head. This is lateral lip of bicipital groove. Now another line which separates this upper end from rest of the shaft. This is the line separating here like this. This line is called as surgical neck. Another line here like this. It indicates, it shows the epiphyseal fusion. This is called as morphological line. Now this head of the humerus, which is medially backward and upward, it articulates with the glenoid cavity of the scapula and form the shoulder joint. Now focusing on the shaft. The shaft has three borders and three surfaces. When we want to find out the anterior border, we have to trace it from here. The upper 1/3, the anterior border forms the lateral lip here, going continue below. Lateral lip of bicipital groove, continue below here, and it forms the anterior border first. While the lateral and medial, another two borders which are present here. Below the head, this is medial. Opposite, it's a lateral. But these two borders are rounded and it is difficult to identify in the upper part. So we trace it from the lower part, that is supracondylar ridges. This is medial supracondylar ridge. If I turn the bone, this is lateral supracondylar ridge. So two borders are easy to trace from the lower end, that is medial supracondylar ridge, lateral supracondylar ridge. Now focusing on the surface, if we want to identify anterolateral surface, so first I identify anterior border, this one, this is a lateral border. So this area between the anterior border and lateral border, it forms anterolateral surface. And the upper half of the surface, it is covered by the deltoid muscle. Here in the middle, it is rough V shape. This is the area which is called as deltoid tuberosity, which receives the insertion of deltoid muscle. Now the border between, again this is anterior border, this is medial border. So area between the anterior border and the medial border, this surface, it is called as anteromedial surface, and it forms a floor of, as we can say, intertubercular sulcus. Now I turn the bone to find out the posterior surface. This is present between the lateral border and the medial border. This area between the lateral and the medial border, it is called as posterior surface, and in the middle part behind the deltoid tuberosity, it has a presence of radial groove or a spiral groove. Now going on the lower end, which is expanded, we can see the structures like this is capitulum, this is trochlea. So these are the two articular parts in the lower end. The capitulum articulates here with the head of the radius, while this pulley shaped structure, this is trochlea, it is going to articulate with the trochlear notch of the ulna. And the medial flange here, you can see on the trochlea, which projects 6 mm down than the lateral one, and this is a result in formation of carrying angle. Now non-articular areas in the lower end, towards the head this is medial epicondyle, opposite it is lateral epicondyle. This is non-articular area. The medial epicondyle, this is subcutaneous. Now the sharp lateral margin just above the lower end, as we have find out the borders, the two borders here, that is medial and lateral. So this is medial supracondylar ridge, this is lateral supracondylar ridge. Now the presence of three fossa. Above the capitulum, it is radial fossa. Above the trochlea, this is coronoid fossa, and accommodates this coronoid fossa. It accommodates the coronoid process of ulna when the elbow is flexed, while this radial fossa, it accommodates with the head of radius when the elbow is flexed. The third one is present on the posterior side. This is olecranon fossa. It is lying just above the posterior aspect of trochlea. This is trochlea. It is situated above the trochlea, and it accommodates with the olecranon process of ulna when elbow is extended. Thank you.